So why is coronavirus more dangerous than the common cold or the flu? What is it doing on the inside to make it such a fatal virus? So by now we all know that COVID-19 is a respiratory illness. It enters our body via the nose, mouth, or eyes. Once it's inside, it latches its spiky protein receptors to our healthy cells. It enters the body and it starts to replicate, multiply itself, making more and more of the virus. This then triggers an immune response as our body detects a foreign object. During this time, you may not feel sick, but you're highly contagious. And this is where the strength of your immune system comes into play. That is why during this pandemic, it is super important to boost our immune systems with diet, lifestyle modifications, so we're able to fight off COVID-19 when we come in contact with it. Next week, I'll be doing a video on how you can do just that. So be sure to subscribe and hit your notification button so you don't miss the video. Once your body detects the presence of a foreign object, it instantly sends over helper cells. T cells, white blood cells, killer cells are activated to eradicate the foreign object. And this is where fever and fatigue come into play. The fever is your body fighting off the infection, raising your temperature, and the fight simply leaves you tired and fatigued. 80% of the population that encounters COVID-19 usually only experience mild or moderate symptoms. The symptoms usually stop at the cough, fever, and the sore throat. And this has a lot to do with your immune system. Now that the virus has entered your body, where does it go first? As I mentioned before, COVID-19 is a respiratory tract infection. So its main source of activity is going to be within the respiratory tract. Now let's take a look to see what that looks like. Once it finds its way into your body, it moves down the lower part of the respiratory tree. And researchers believe there are more receptors for COVID-19 within the lower part of the respiratory tree, which means there are more places for it to attach than, say, the common cold or the flu, which are also viruses, by the way. It moves down the respiratory tract, and this is where the exchange of oxygen occurs. We breathe in oxygen, we exhale carbon dioxide. And a little side note on oxygen exchange. Trees breathe in carbon dioxide and exhale oxygen. And this is why trees are so important to our environment. They ultimately help us breathe. COVID-19 causes severe inflammation of the alveoli, the branches of the respiratory tree, preventing the exchange of oxygen and carbon dioxide from happening. And this is where the dry cough comes into play. The inflammation that starts to gather within the alveoli causes a dry cough because you are now struggling to inhaled air. Because there are more receptors within the lower respiratory tract, which is the most crucial part of the respiratory system, that makes this virus very, very harmful, more than the common cold or the flu. Let's get a better understanding of how the respiratory tract works. Think of the respiratory tract as an upside down tree. The trunk of the tree is your trachea or your windpipe. It splits into smaller and smaller branches into your lung. At the end of each branch are tiny sacs called alveoli. The alveoli is responsible for the exchange of oxygen and carbon dioxide. Now, let's not forget your body is still in defense mode and it's trying to fight off the infection as it travels down the respiratory tract. But at the same time, you're struggling to breathe. The inflammation eventually travels down your lungs and your airways begin to swell, which leads to more inflammation. And inflammation is the main cause of fatalities within COVID-19. As the swelling gets worse, your lungs fill with fluid and debris. The debris accumulates, causing blockages within the alveoli. The accumulation of inflammation and debris circling around in your system can also lead to blood clots. And the way the blood travels within our body, when it leaves the lungs, it's going to go directly to the brain, which causes a stroke. And we've unfortunately seen this in our hospital where we've stabilized patients, we've sent them home, and they've returned back to the ER because of a stroke. And I'll go into detail in another video on how underlying conditions put you at a higher risk for fighting off COVID-19, and not just COVID-19, any type of infection. So if you've been considering getting healthier, making lifestyle modification, this is the time to do it. This pandemic, if it hasn't done anything, it should have opened your eyes to becoming healthier, providing your body with the nutrients that you need to fight off infections, not just COVID, changing your diet, changing your lifestyle. If you're a smoker, this is the time to quit smoking, because it is no longer if you come into contact with COVID-19. It's when you come into contact with COVID-19. Will you be ready? Are you providing your body the nutrients that you need to fight off an infection? Are you boosting your immune system? Are you making lifestyle modifications? Are you getting adequate sleep? If you aren't, it's time to consider it. I'm sure you've heard plenty of people questioning, why is this virus causing such havoc on our community versus any other virus? Be sure to share this video with that person. Give them the insight of what's going on with COVID-19. Be sure to subscribe, turn on your notifications so you don't miss out on any of this important info that I'll be going over for the rest of the month.
Thank you for joining me. Be sure to subscribe, like, comment, and share. Follow me on Instagram at Getting Healthy with Dr. T.